If we count aesthetic flaws, aesthetic deformities, especially on our legs, such as the leg being crooked, being bow-legged, we can make a classification, a categorization, such as being thin or being thick. In this broadcast, we will tell you, I will discuss liposuction slimming for thick legs. A thick leg appearance, particularly in the region below the knee, is not a very common presentation. And when it does happen, it causes significant aesthetic and functional issues for the patients. Basically, in the leg area below the knee, the fat tissue is slightly less in fat tissue thickness when we compare it to the normal population. Therefore, while examining you, we will attempt to ascertain the thickness of the subcutaneous fat tissue during the examination, and we will explain how much we can help. Therefore, if we have a problem related to lymphedema in the area below the knee during the examination, we will not assist you with the liposuction method. For this, we will refer you to our physician colleagues, our peers, regarding lymph drainage or lymphatic surgery. However, fundamentally, we can offer you a successful solution with liposuction very clearly in cases of leg thickness originating primarily from fat tissue. There are some surgical technical details here. From which regions of the leg can we harvest fat tissue? Or what specific types of cannulas are required from a surgical technique standpoint when removing fat? These are very important matters. Is leg liposuction done like normal liposuction? Theoretically, yes, it can be done, but we need to be a bit more careful on the leg. For instance, considering the diameter, we must employ somewhat finer cannulas. Perhaps we should utilize 2 mm or 3 mm cannulas. When considering the speed of operation, we ought to proceed somewhat more slowly in order that we do not create any functional issues, or alternatively, the final outcome we achieve can be superior and excellent. We can perform this surgery under local anesthesia, or we can also perform it under spinal anesthesia by numbing the waist. It generally lasts around 1 to 1.5 hours. Because working with slightly more precision and at a slower pace is required on the leg, the operative duration will be somewhat extended. But you can leave the hospital the same day. After the surgery, I specifically recommend compressive garments to my patients for 3 or 4 weeks. These can be corsets, or support stockings, may also be sufficient for the compression we need. We expect to see the final outcome within roughly 1.5 to 2 months, and you will observe a significant reduction in your leg size.